Welcome to SSR Conference 2022. Before I start, I would like to thank our guest of honor, Ms. Su Jieling, Minister of State in the Ministry of Social and Family Development and the Ministry of Education. I would like to thank our keynote speaker, Dr. Gerard Yee, Chairman of the Agency of Integrated Care. I would also like to thank the Ministry of Social and Family Development and Tote Board for their support for this conference and for their support for our center, Social Service Research Center's work in the social service sector. And I also like to thank my colleagues at SSR for their tireless work at making this conference a reality. I would like to thank all our speakers and moderators. I very much look forward to your talks. Last but not least, I would like to thank all of you for attending this conference. COVID-19 is not just a physical health issue. It is also a mental health issue, a social health issue, and a societal health issue. Singapore, like many parts of the world, has suffered numerous negative impacts as a result of the pandemic in almost every area of life. Many Singaporeans have reported distress in their personal lives and disruptions to their livelihood. According to the COVID-19 Mental Wellness Task Force report, Singaporeans reported significant worries on several issues, including how the pandemic might impact the health of their family, their financial adequacy, their employability, their future, and their academic and workplace performance. Family lives have also been affected, with some studies reporting more family conflicts. Social workers are not spared too. By the nature of their job, social workers are already quite vulnerable to stress and burnout. COVID-19 only increases this vulnerability. In fact, one study conducted in the early stage of the pandemic, June 2020, found that close to half of frontline social workers in Singapore reported mild to severe levels of depression and anxiety. So these many concerns felt by many individuals in Singapore pull together and accumulate over time to make COVID-19 a societal issue on many levels, impacting education, healthcare, commerce, employability, sports, arts, and ultimately the well-being of our nation. But all is not gloom and doom. I would also like to advocate a mindset that we all know, but it's easy for us to forget, which is to focus not just on the negatives, but also, more importantly, on the positive. This means that while it is important to be aware of the problems, it is even more important to appreciate the positive, focus on the possibilities, and to seek progress. Okay. So, despite the many problems, Singaporeans have also shown considerable resilience and optimism during the pandemic. But by and large, Singaporeans have demonstrated a high degree of civic-mindedness and social responsibility, as shown by their sustained efforts in maintaining personal hygiene and abiding to safety measures. In one study, many respondents said they would seek professional help for COVID-19 related emotional problems, which to me indicates that many Singaporeans would face their mental challenges rather than denying or suppressing them. There have also been significant levels of personal resilience among social workers, as many of you can attest, because your work goes on and never stopped for the past 2 years. And I believe that all of us have encountered or heard of inspiring stories about how Singaporeans handle the pandemic or help others cope with the pandemic, including stories such as healthcare workers working more hours, Singaporeans providing meals to vulnerable groups, social organizations providing electronic devices to low-income families with children, and residents placing hand sanitizers in void decks and lifts for their neighbors to use. The last example happened in my flat. In SSR, likewise, we adopt the same mindset. We are mindful of the problems that COVID-19 brings, but we choose to focus on the positive, try to offer possibilities, and seek progress by contributing in various ways to enable positive changes in the social service sector. Our training workshops equip social service partners with the knowledge and skills to conduct research. In our research capabilities development service, we work with social service agencies in their research projects to understand and evaluate their programs. Both contribute to enhancing the research proficiency of social service agency to evaluate their policies and programs in the context of COVID-19. Our research studies conducted during the pandemic can offer insights into how Singaporeans cope with daily problems due to the pandemic. Through our research capability services and academic research projects, we can gain empirically based insights that will inform practice, increase the effectiveness of social service programs, and ultimately improves the lives and well-being of people who have fallen into times of needs. We report our research findings not only in academic journals, but also in other channels that enable quicker dissemination of evidence-based knowledge, which is critical in this rapidly changing environment brought about by COVID-19. Such channels include reports, news commentaries, and SSR valid-owned snippets publication. Now, it is with the same mindset that drives this conference. It is the same mindset that we encourage you to approach the talks and discussion with. You will hear thought-provoking presentation on any socially relevant issues, such as what groups are most vulnerable to mental health and livelihood repercussions, what care is available to vulnerable older persons to enable them to thrive in the COVID environment, what are the community-wide and societal-wide practices and structures that support responses to challenges intensified by COVID-19, have digital access and digital inclusion being compromised during the pandemic, and how can we move towards digital equality? As you listen to the presentation, yes, you will hear about the problems, be mindful of them, it is important too, but more important, I will ask you to ask what are the positives, what possibilities in terms of programs and policy solutions do they suggest, and what pathways to progress do they offer? I hope you enjoy this conference. Thank you.